Hi, I'm Venki Munikrishnan. I'm a consultant colorectal surgeon. Today we're going to be discussing hemorrhoids, commonly known as piles. Just going to do a screen share. Okay, so if you look at the normal anatomy, when we eat food, the food comes down the food pipe of the esophagus, goes into the stomach where it gets digested, and then the food material comes into the small intestine where all the important nutrients are all extracted, and the waste material is pushed into the colon. This waste material or fecal matter comes and finally rests in the rectum to be expelled out at a suitable time. If you look at the rectal and the anal picture here, the most important thing we need to remember for purpose of this discussion, there are two important muscles, the internal and the external sphincter, which control the defecation process. There is also this blue tissue here, which are known as hemorrhoidal cushions. Now, these cushions are very important because they give you an airtight seal, like a washer, to retain liquid and gas so that they don't leak out. This is very important. Now, when we strain or become constipated, these tissues start to become bigger or swell, and that's when they are called hemorrhoids. Now, let's look at what are the most common symptoms one faces with hemorrhoids. The most important thing to remember is that the most common symptom with hemorrhoids is painless rectal bleeding. Painless rectal bleeding. Now, I know it's synonymous to think about pain when you think about hemorrhoids, but please remember when you have severe pain when you go to the toilet with some rectal bleeding, it's most commonly due to an anal fissure, which is a little crack on the right at the anal edge. Hemorrhoids normally do not cause pain. So the most common symptom is painless rectal bleeding. Now you can have occasional pain that's due to a thrombosed hemorrhoid or a blood clot around the anus, but that's not very common. You can also complain of anal lumps. Patients also complain of anal itching or incomplete evacuations. They feel that they're not completely evacuated and they need to go back to the toilet 2 or 3 times late in the day. Now, the most common causes why people develop this is because of constipation and also repeated straining in the toilet. One other habit which I notice in my practice is that people take their phones and newspapers into the toilet. Please try avoiding it because you will be sitting there straining in the toilet and causing more trouble than you can imagine. Also, rectal cancer can have similar symptoms. That's why it's very important. If things don't settle in 4 to 6 weeks, you better go see a doctor or a specialist who can examine you and then give you further advice. Again, one of the most common reasons why people develop these things are because of poor diet and water intake. So, what are the first line treatments? Simple things which you can do right at home is to change your lifestyle. Please increase your water intake. I would suggest at least 3 liters of water per day, more fresh fruit and vegetable, reduce your intake of meat, regular exercise, and also, if required, you can get a simple laxative from the chemist. And usually, things do settle down very nicely. If things don't settle, then please go see your doctor or a specialist who can advise you further. So, what are the treatments available in the outpatients? In the outpatients, there are several new treatments and some old treatments which are very effective. The most common one I use is what we call banding of piles or hemorrhoids. These are simple treatments, takes about 15-20 minutes with an 80 to 85% success rate of complete cure and can be very simply done in the outpatients without any anesthesia at all. The other procedure with some local anesthesia is a Raffaello procedure, now becoming very popular in Europe. If banding and lifestyle change don't work, then we can try the Raffaello procedure. And if those things don't work, then you can try ultrasound guided new techniques to identify these hemorrhoids and tie them off. Or you can go for the traditional, not traditional, but an operation which is quite popular, which is called the staple hemorrhoidectomy, which has been around for a couple of decades with really good results, but a slightly higher recurrence rate compared to the standard operation. The standard operation still is the gold standard where you cut out these hemorrhoids. Initially, it's very painful, but in the long term, gives excellent results. Although patients find it extremely painful in the first few weeks, but in the long term, as I said, the recurrence rates are low, and the complications are much less compared to any other invasive procedure. So to summarize, hemorrhoids can be 4 stages. One, when it's when you see some rectal bleeding and there's no protrusion of these lumps or hemorrhoids. So at that stage, you can increase your water intake, try some laxatives, eat some vegetables and fruits, avoid red meat and avoid straining. Usually things settle down. If things progress, then they go to stage 2, when these hemorrhoids will start to protrude out a bit, but they spontaneously reduce. So at that stage, you could try banding of hemorrhoids or piles, injection sclerotherapy, and also these hemorrhoidal artery ligation using the ultrasound procedures. Now, then we move on to stage 3, where these hemorrhoids will protrude, and sometimes they have been pushed back in manually. And at that stage, you probably need a more formal operation. And in stage 4, when these hemorrhoids permanently stay outside and they can't be pushed back in, and then you'll definitely need to have some form of operation to get that. So this is a summary of how you manage hemorrhoids, common symptoms, and what are the treatment options available. If you need more information, please visit our website, and there is tons of information there. You can always email